Center Test Prep Exam Edge Reviews. Question 1. A patient presents with severe epigastric pain radiating to the back, nausea, and vomiting. The nurse notes ecchymosis around the umbilicus. This finding is known as Option A, Gray-Turner sign, Option B, Cullen sign, Option C, Murphy's sign, Option D, Freifsing sign. The correct answer is Option B, Cullen sign. Cullen sign, periumbilical ecchymosis, and Gray-Turner sign, flank ecchymosis, indicate retroperitoneal hemorrhage, classically associated with hemorrhagic pancreatitis. Question 2. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive for fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all for fluids. The correct answer is Option B, keep the patient NPO and provide aggressive for fluid resuscitation. Initial management of acute pancreatitis includes bowel rest, NPO, to reduce pancreatic stimulation, and aggressive for fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. Question 3. What is the priority intervention for a patient with an open fracture? Option A, immediate surgical debridement. Option B, to apply traction. Option C, cover the wound with a sterile saline moistened dressing and immobilize. Option D, administer analgesics. The correct answer is Option C, cover the wound with a sterile saline moistened dressing and immobilize. In the emergency department, the initial management of an open fracture includes covering the wound with sterile, moist dressings to prevent further contamination and desiccation, and immobilization of the limb. Question 4. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to: Option A, administer oxygen. Option B, place the patient in Trendelenburg position. Option C, immediately discontinue the procedure. Option D, assess vital signs. The correct answer is Option C, immediately discontinue the procedure. The nurse should instruct the provider to immediately stop the procedure to reduce vagal stimulation and prevent syncope. After the procedure is stopped, the patient can be placed supine and assessed. Question 5. The most common cause of acute renal failure in hospitalized patients is: Option A, glomerulonephritis. Option B, acute tubular necrosis. Option C, renal calculi. Option D, pyelonephritis. The correct answer is Option B, acute tubular necrosis. Acute tubular necrosis, ATN, is the most common cause of intrinsic acute kidney injury, often due to prolonged hypotension or nephrotoxic agents, causing ischemia or direct tubular damage. Question 6. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to: Option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is Option B, perform a retrograde urethrogram before catheter insertion. Blood at the urethral meatus is a classic sign of urethral injury. A retrograde urethrogram must be performed to assess urethral integrity prior to any catheter insertion attempt. Question 7. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray. Option B, abdominal ultrasound. Option C, CT scan of the abdomen. Option D, complete blood count. The correct answer is Option C, CT scan of the abdomen. CT scan of the abdomen with full contrast is the most accurate imaging modality for diagnosing appendicitis, though ultrasound is often the initial test in children and pregnant patients. Question 8. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B. Hypotension, muffled heart sounds, distended neck veins. Beck's triad consists of hypotension, from decreased cardiac output, muffled heart sounds, from fluid in the pericardial sac, and jugular venous distension, from impaired venous return. Question 9. Pulsus paradoxus is a classic finding in which condition? Option A. Cardiac tamponade. Option B. Pulmonary embolism. Option C. Aortic aneurysm. Option D. Congestive heart failure. The correct answer is option A. Cardiac tamponade. Pulsus paradoxus, an exaggerated decrease in systolic blood pressure, 10 mmHg, during inspiration, is a hallmark finding in cardiac tamponade and is also seen in severe asthma and COPD exacerbations. Question 10. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate. Option A. No tetanus prophylaxis needed. Option B. Tetanus immunoglobulin only. Option C. STIP or TD booster. Option D. Tetanus toxoid and tetanus immunoglobulin. The correct answer is option C. STIP or TD booster. For a clean, minor wound and a vaccination history of more than 10 years since the last dose, a STIP or TD booster is indicated. Tetanus immunoglobulin is for patients with unknown or incomplete vaccination history and contaminated wounds. Question 11. Which finding is consistent with an anterior shoulder dislocation? Option A. Arm held in internal rotation and adduction. Option B. Arm held in external rotation and slight abduction. Option C. Patient unable to flex the elbow. Option D. Numbness of the medial forearm. The correct answer is option B. Arm held in external rotation and slight abduction. In an anterior shoulder dislocation, the most common type, the patient typically holds the arm externally rotated and slightly abducted, resisting any movement. Question 12. A patient with an acute myocardial infarction develops a new hollow systolic murmur at the apex that radiates to the axilla. The nurse suspects which complication? Option A. Ventricular septal rupture. Option B. Papillary muscle rupture with mitral regurgitation. Option C. Pericarditis. Option D. Aortic dissection. The correct answer is option B. Papillary muscle rupture with mitral regurgitation. A hollow systolic murmur at the apex radiating to the axilla is characteristic of acute mitral regurgitation, often caused by papillary muscle rupture, a mechanical complication of ME. A VSD murmur is typically heard best at the left sternal border. Question 13. A patient with a Lefort 3 fracture is at highest risk for: Option A. Dental malocclusion. Option B. Airway compromise. Option C. Corneal abrasion. Option D. Temporomandibular joint dysfunction. The correct answer is option B. Airway compromise. A Lefort 3 fracture, craniofacial disjunction, can cause posterior displacement of the maxilla and soft palate, which can obstruct the airway, making airway assessment the highest priority. Question 14. Which ECG finding is most indicative of hyperkalemia? Option A. Prolonged QT interval. Option B. Peak T waves. Option C. ST depression. Option D. Delta waves. The correct answer is option B. Peak T waves. Peaked, narrow, symmetrical T waves are a classic early ECG sign of hyperkalemia. As potassium levels rise further, P waves flatten, the PR interval prolongs, and eventually the QRS widens into a sine wave pattern. Question 15. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, trickle deviation to the left, and hyperresonance to percussion on the right. The priority intervention is: Option A. Obtain a stat chest X-ray. Option B. Needle decompression at the right second intercostal space. Option C. Administer albuterol nebulizer. Option D. Prepare for intubation. The correct answer is option B. Needle decompression at the right second intercostal space. The presentation is classic for tension pneumothorax, trickle deviation away from the affected side, hyperresonance, absent breath sounds, and respiratory distress. Immediate needle decompression is life-saving. Question 16. Which assessment finding is consistent with a flail chest? Option A, crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, trickle deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Flail chest occurs when two or more adjacent ribs are fractured in multiple places, creating a free-floating segment. The segment moves paradoxically, inward during inspiration, outward during expiration. Question 17. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects: Option A, hemorrhagic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Neurogenic shock results from loss of sympathetic tone following spinal cord injury above T6, leading to unopposed parasympathetic activity causing vasodilation, hypotension, and bradycardia. Question 18. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is: Option A, obtain a urine pregnancy test. Option B, administer pain medication. Option C, prepare for pelvic exam only. Option D, discharge with follow-up. The correct answer is option A, obtain a urine pregnancy test. The presentation suggests a possible ruptured ectopic pregnancy, which is a life-threatening emergency. A pregnancy test is the critical first step. An IUD increases the risk of ectopic pregnancy if conception occurs. Question 19. Which finding on end-tidal CO2, ECHO2, monitoring indicates successful endotracheal intubation? Option A, ECHO2 of 0 mm Hg. Option B, persistent ECHO2 waveform with each ventilation. Option C, ECHO2 of 50 mm Hg. Option D, a flat line waveform. The correct answer is option B, persistent ECHO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flatline reading suggests esophageal intubation. Question 20. Hepatitis is primarily transmitted via: Option A, blood and body fluids. Option B, fecal-oral route. Option C, sexual contact. Option D, contaminated needles. The correct answer is option B, fecal-oral route. Hepatitis is transmitted primarily through the fecal-oral route, often through contaminated food or water. Hepatitis B, C, and D are bloodborne. Question 21. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of: Option A, acute glaucoma. Option B, retinal detachment. Option C, corneal abrasion. Option D, cataract. The correct answer is option B, retinal detachment. The patient's description of a curtain being pulled down or a shade being drawn over their vision is the hallmark symptom of retinal detachment. Question 22. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. In the early, compensatory stage of shock, the body attempts to maintain cardiac output and perfusion. Tachycardia and peripheral vasoconstriction are key early compensatory mechanisms. Question 23. The hallmark sign of compartment syndrome is: Option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding. Question 24. To calculate cerebral perfusion pressure, CPP, the nurse needs to know: Option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D, central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. CPP equals MAP ICP. A normal CPP is 60 to 80 mm/Hg. Maintaining adequate CPP is critical to ensure cerebral blood flow in patients with elevated ICP. Question 25. A patient who has received massive blood transfusion protocol is at risk for which electrolyte abnormality due to citrate preservative in blood products? Option F, hyperkalemia. Option B, hypercalcemia. Option C, hypercalcemia. Option D, hypomagnesemia. The correct answer is option C, hypercalcemia. Citrate, a preservative in transfused blood products, chelates ionized calcium, leading to hypercalcemia, which can cause paresthesias, tetany, and cardiac dysrhythmias.